And May is National Stroke Awareness Month. So joining us now, we want to talk about signs and symptoms to be aware of, tips to reduce your risk. Dr. Scott Flinn is here, Regional Medical Director for Blue Shield of California. And Dr. Flinn, you've also served as the captain of the U.S. Navy Medical Corps for 22 years. Thank you for joining us today.
Thank you for having me.
Tell me, as far as the most important message that you want to get out to our viewers at home to make sure they stay healthy, what do we need to know about strokes?
The most important message is time. Time is of the essence. If you're having a stroke, getting care immediately is key.
Okay.
And that means being able to recognize it and then act on it right away. And there's a little acronym we use to help folks recognize it. It's called Be Fast. Balance, if you're losing balance suddenly. Eyes, your vision changes suddenly. F is for face, get a facial droop. A is for arms, your arms get weak all of a sudden or it starts to go this way. S is for speech, you start slurring your speech or something doesn't sound right. You can't, people say, you don't sound normal.
Wow.
And T is for time,
Okay.
and time is of the essence. Every minute that you have a stroke is basically an interruption of the blood flow to the brain.
Okay.
Be it either from a clot or from a bleed. And you lose 2 million brain cells a minute.
Wow.
And most of us don't have a lot to start with, right? So 2 million a minute is a lot.
Wow.
So it's important to get care right away. And that's what the T is, it's time. Time is of the essence. And it's important that you call 911 right away if you think someone's having a stroke.
Okay.
Do not call your doctor, do not call your nurse friend, do not call auntie. Don't put someone to bed and say, oh, they're just having a spell, put them to bed.
Yeah.
That actually happened to my wife's grandfather. And they said, oh, he's having a spell. They put him to bed. He woke up the next morning. He was paralyzed on his right side.
Oh, that's scary.
So,
do people just kind of put it off and think, oh, I'm just like a little numb, it'll go away?
Yeah, or numb, or yeah, like I said, it's having a spell, just put him to bed, sleep it off. No.
Okay.
And the key is when you call 911, they can get you to the hospital. We have stroke centers here that can get you in, get a quick CT scan to see if it's a bleed or not, and then they can do interventions that can actually not only save you from progressing, but actually help with reversal of what may have happened already.
Which that's why getting there
Key.
fast. Okay.
Time is tissue.
Okay, because ideally you could get back to normal after a stroke, which we have heard these incredible recoveries.
Some people can recover completely. The longer you wait, the worse it gets.
Okay.
Time is tissue.
Very important message here. Be fast. That's an easy
fast.
one to remember. I like that. As far as prevention goes, what can we all do in our day-to-day lives to help?
The number one thing that's preventable is your blood pressure.
Okay.
Know what your blood pressure number is, because most folks don't even know what it is. You know, it's called know your numbers.
Okay.
And then if it's high, get it treated. Blood pressure is a silent killer. Hypertension is a silent killer. You don't have any symptoms for it until you get a stroke or a heart attack.
I see.
So get your blood pressure checked,
Okay.
and if it's high, get it treated. There's lots of meds out there. They're dirt cheap, and they work very well and have low side effects.
And as far as getting your blood pressure checked, I know when I was pregnant, we checked because I had preeclampsia.
Oh,
but
boy.
I don't check ever since. But it's important to find places to go and do this, right? I mean, is it easy to do at home?
Okay, I don't want to put you on the spot.
Yes, no, that's
but
okay.
if you had preeclampsia, high blood pressure when you're pregnant, you're at greatly increased risk for hypertension now.
Good to know.
So you should go to your doctor and get it checked. That's the best place to get it checked is in the physician's office.
Okay.
Because they have
How often?
At least once a year.
Okay.
They've calibrated their blood pressure machines.
Gotcha.
The ones at home may or may not be calibrated. If you have one at home, make sure you get it checked to make sure it's reading accurately.
Okay.
But the important thing is to get it checked and know your numbers.
So once a year is pretty good if you're not showing any kind of signs. Okay, I see, if it's not too high. As far as resources, where can people go to get more information about this? Where should they go?
Yeah, Blue Shield has a website called Wellvolution that we can go on to learn things about how to look for your blood pressure, how to diet, how to exercise. Exercise and diet do help prevent strokes also. And there's plenty of other resources that are available. If you just Google in stroke, there'll be plenty of stuff pulls up about, again, that Be Fast algorithm or mnemonic that you can have.
Okay.
Balance, eyes, facial drooping, arms, speech.
Okay, and time. Really
Get it
important.
going. Yes.
Dr. Flinn, thank you for joining us today with this important message. Hopefully our viewers at home a lot healthier now. Just knowing this will hopefully get them in the right direction.